Back in 2014, Crusader Community Health didn't have any in-house staff to provide behavioral health services. Instead, Crusader contracted with one licensed clinical social worker to support patients and their mental wellness. Now, a decade later, Crusader employs 22 behavioral health staff with plans to expand. 12 of those 22, more than half, are paid for with funding from the Winnebago County Mental Health Board and voter-approved half-cent sales tax.
The taxpayers of Winnebago County recognize the need and the importance of mental health in our community, and we're just grateful and thankful that the voters approved the referendum to provide this support for us, and we're very proud of the services that we've been able to offer and the help that we've been able to provide.
Crusader Community Health provides Northern Illinois with comprehensive, affordable, and accessible medical, dental, and behavioral healthcare services for anyone in need. As that need has grown in our community for affordable primary health care, including behavioral health services, Crusader Community Health has expanded. With support from the half-cent sales tax, our services are more robust than ever.
If you're a patient here, you're able to access behavioral health services because behavioral health care is health care, and those things are integrated here.
That integrated model of treatment means mental health services are provided in a primary care setting. Patients can receive their primary care and behavioral health care all under one roof with collaboration and coordination.
We want to be seen as the patient coming in, that we are just a piece of their health care and that we're a part of their team.
Crusader provides behavioral health services for children, adolescents, adults, and families, like assessments, diagnoses, therapy, psychoeducation, relapse prevention planning, crisis intervention, and treatment recommendations in collaboration with medical providers.
We recognized how important it was that good mental health care, good behavioral health care is necessary in order to get good medical care and medical outcomes for patients who need that.
That additional investment is refreshing. Will Holm, now the department chair for behavioral health, was the lone LCSW Crusader contracted with a decade ago.
It's been a welcome change. Being in the field as long as I have, I remember back when mental health was really kind of marginalized and there was not a focus on mental health. Mental health, substance use, this is becoming recognized, and that it's serious. It impacts anyone and everyone across the age span, across socioeconomic. It has no boundaries that way.
In this program year alone, Crusader added another behavioral health case manager, a part-time child and adolescent psychiatrist, plus a licensed professional counselor to specifically support women's health patients.
To have this fund available for Crusader and so many other organizations to really try and be more comprehensive in meeting community-wide needs is really spectacular, I think. But then kind of taking a step back and looking community-wide, I think it's great that our community is able to acknowledge this is a need that we have and we're going to take action to make some improvement there.
The increased access, turns out, is exactly what patients both want and need. Recent behavioral health patient survey data show 94% of patients were able to get an appointment exactly when they wanted it. 97% of patients said their provider spent enough time with them. 91% said they felt heard, understood, and supported by their case manager. 93% were motivated to use the information they received in their appointment.
It's incredible the feedback that we're getting, that they're able to access appointments when they want, but more importantly, that they're seeing a benefit, and it is making a difference, and it's improving their lives. And it's neat to be part of that. With these resources that we've gotten, these sales tax dollars, we've been able to see that what we suspected was true as we expand access to mental health services, that patients do receive higher, better level of care and adherence to not just in the behavioral health area, but also into the medical as they interact with their medical providers and actually end up with a higher quality of life.
This funding increases accessibility to address patients' needs and reduces barriers to their care. On behalf of our behavioral health team and all of us here at Crusader Community Health, thank you for supporting our patients and our community.